The best test for S1, by far, if you're really serious about it, and again, remember, screen S1 if they're a back dominant, ankle reflex, fine, is gluteus maximus. And we talk again about why not test the muscle power because it's awkward. But what maximus does is contract. Okay, this is going to be the giggle test. I need a male volunteer. Come on up and be. I used to use girls, but then they reported me to the college, so I had to give that up, which was a shame because it was always the best part of my lecture. Lie on the bed face down for me. All right? Everybody giggles and they shouldn't, but they do. If you squeeze your butt together, that is an S1 function, total S1 function. You relax, tighten again. I can feel the muscle contract. Half a dozen reps, tops, and the S1 deficient muscle softens to the point where your fingers just sag in on one side and bounce back on the other. So if I really think S1 is issue, this is my test. I'll screen you with ankle reflexes or I'll have you toe raise. But if I'm really serious, you're leg dominant and I want to know what level it is, I will always do the maximus. You could do the test by using this muscle by having you extend your hip because it is a major hip extender. But here again, this is awkward, it's cumbersome, it hurts. Much better to just test muscle tone. And again, reps, softening, perfect. It's a nice test because people don't know what you're doing, and not everybody can tighten one buttock. Now, some can. I used to years ago when there were huge medical school classes. Yeah, can you do it? There used to be huge medical schools in Toronto, 300 kids in a room, and I would make the statement that nobody could, and then I would watch 300 people squirming in their seats, until somebody managed to tighten one cheek, and then you'd get a big smile on his face. He'd say, thanks very much. So it's a very good test, very sensitive test for S1. So that's it. That's all you need for physical exam. L4 you've got, hit the knees. L5, it's the ankle dorsiflexion, big toe sticks up, Trendelenburg. S1 is ankle reflex, stand on your tiptoes, or curl your big toe, by the way. S1 is also the big toe flexor, which I personally like as a simple test, and gluteus maximus. So those are the physical tests that get sorted into this whole question of, what has this person got? And without any of those things, in our case we're discussing, this guy hasn't got a sciatica. He's not got any positive neurology. We talked about SLR yesterday, so we're on our way. Where'd she go? She's up there hiding in the back. You got us all into that with your questions, so thank you very much. Any other physical exam questions before we... Okay.